25 new cases today. That brings to 185 the number of active coronavirus cases here in Victoria. We have 4 Victorians in hospital, one of whom is in ICU, and of course we send our very best wishes to everybody who's recovering from coronavirus in our state. We now have over 500 exposure sites and over 13,000 primary close contacts who are out there isolating for their 14-day period in a far harder lockdown than the rest of us are in Melbourne at the moment. In terms of the 25 cases we have at the moment, 10 of those are associated with household members from Al-Taqwa College, particularly 2 families, one family of 6 and one family of 3, all with positive cases in their household, and one further household member of a student. And it highlights how aggressive this virus is when it gets into your community. When it gets into your household, the attack rate of this virus is exceptionally high. We also have 7 positive cases today associated with the Glenroy West Primary School cluster. Again, 6 students from the school and 1 household member. That takes us to 17. And there are 3 cases associated with the Caroline Springs Shopping Centre, Caroline Springs Square Shopping Centre, 3 household members, 2 associated with the Jolly Miller Cafe, and 1 with the YPA estate agency. That takes us to 20. We've then got 5 cases that are essentially mystery cases or unlinked cases. One of them is a social contact of the Middle Park case we identified on Friday. So we have linked those 2 cases together. But we do not know the acquisition yet of that Middle Park case. The second mystery case today is a cleaner who lives in the city of Greater Dandenong. It's a commercial cleaner who has worked on Fitzroy Street. We believe there's a connection there with the case from Middle Park. So there may be a connection between these 3 cases, but as yet we haven't concluded that linkage. But it is a case who now resides in Greater Dandenong and has a number of other exposure sites. And then we also have a case who's a construction worker or construction services worker who lives in West Footscray. And again, no other linkages yet to any known positive cases. Finally, we have 2 cases from St Kilda East, a mother and her adult son. We've had significant community engagement around these 2 cases last night and again this morning. And my thanks to the entire community in that part of our city for coming together to work through some potential significant exposure sites and community contacts. We'll be working through that over the coming hours and days. That takes us to 25 cases for today. 12 of those cases are isolating, particularly those associated with Al-Taqwa College and Caroline Springs. There were 1 or 2 of those cases who had longer. We've taken a very cautious approach around the potential exposure period that predates the start of their isolation. But on the whole, the isolation protocols have been exceptionally effective for both the school and for those involved with Caroline Springs. And my thanks to everybody who's been doing the hard yards of isolating over the last week or 10 days. This outbreak has moved through a number of different phases already in the 10 days that we've been working on this. We started off with a significant number of community outbreaks and school cases. 68 of our cases so far in this outbreak are associated with that initial set of around 10 schools working through a number of different settings. We saw 4,500 primary close contacts associated with those schools. Almost 90% of those people have already completed their first test. They're now heading into day 13 testing in the coming days. That part of the outbreak's been very controlled. We've seen exceptionally compliance and work with the wider school communities, very strong adherence to the isolation protocols, and my thanks to all those communities for their hard yards they did at the start of this particular outbreak. We then moved into outbreaks like the Newport Footy Club. Again, 1,200 or so primary close contacts associated with Newport Footy Club. Around 8 out of 10 of those already returning negative test results. Again, a fairly well-controlled part of the outbreak. And then into around 3,800 PCCs associated with Caroline Springs and Melton, so moving into those retail settings. Again, 39 cases now associated with Caroline Springs and Melton, over 80% negative test return rate on over 3,500 people. So again, a really strong and well-controlled part of the outbreak. Our concern at this point is that rather than the outbreak now running out, as we saw with the previous outbreaks we've been dealing with, we're now seeing more exposures coming up and more clusters being initiated, and the Premier has spoken to this. So we now have 28 positive cases associated with the Glenroy West cluster, again over a fairly significant geography. A lot more work to do, over 500 primary close contacts at the moment, 2/3 of those have returned a negative test result already. We have a cluster of activity now around St Kilda East, 2 positive cases identified yesterday afternoon, a lot of work ahead of us over the coming days to try and work out all those potential social contacts and to get them tested and supported. There is additional testing facilities being set up today at Caulfield Hospital and some other sites, and we'll advise as we carry on with that work. We have a lot of work to do around the Middle Park case and a number of potential links, so 2 cases likely to be linked to that Middle Park case, a number of exposure sites in the southern part of our city around that. And then we have some other unlinked cases, the West Footscray construction worker I referred to earlier, as well as some distribution workers identified in earlier days. So we still have a number of loose ends and mystery cases where we're not yet clear about the source of acquisition. The genomics that we have is telling us that they're all connected, so we know there's movement around. And what we're really seeing is that this outbreak is now not just concentrated to the western suburbs. And my call out today is, if you're living in Melbourne, you are potentially at risk from this virus and where it's spreading to. This is not just a western suburbs issue. We have positive cases living in Frankston, living in Dandenong, living across our eastern suburbs, St Kilda, Middle Park, City of Melbourne, as well as across our northern and western suburbs. So please do not think that this is something that's impacting only other people in other communities. This is something that is now touching us all somewhere in Melbourne. And in particular, what we're seeing is the virus is taking a lift on some of these cases we've seen with essential workers. And those of us who are essential workers have not only an opportunity to keep working, and that is not only a privilege, but it's also a responsibility. It is so important. If you're an essential worker continuing to travel through our city at this point in time, you must be on top of your symptoms. As soon as you see any symptoms whatsoever, as soon as you come within a hair's breadth of any of these exposure sites, you must get tested at the first opportunity. We're seeing children gathering, we're seeing schoolwork clubs, we're seeing sleepovers. If those things are happening to your children, if your children have been contacting each other or been with other kids over the recent days, you must go and get them tested today. We have seen positive cases coming out of this outbreak from that kind of contact. If you're supposed to be working from home because you can and you're choosing to work from an office, we'd like you to go and get tested. Because again, we've seen people who are not abiding by the work from home directive who are picking up coronavirus and spreading it into their community. So please, and of course we always see those understandable but so very dangerous household gatherings, household visits, popping over just to see somebody to make sure they're okay, all understandable but also dangerous because we're seeing the virus hitch along and move from one outcluster to another. So please, if any of those scenarios are applying to you, if you've got any reason to be concerned whatsoever, if you've got any symptoms whatsoever, I know it's a nice day out there, we need you to go and get tested today. We are not, frankly, seeing enough activity in our testing centres at this point in time, given the number of different strands that we're picking up every single day. So my thanks again to everybody who is doing the hard yards, whether you're in isolation, whether you're adhering to the requirements of lockdown, whether you're going out and getting tested. We're so grateful for everything that you're doing. We need all of us to do our part over these critical few days ahead.